Joint pain. It can happen to anyone at any age, and you don't have to be an elite athlete to experience this kind of injury. Whether it's from working out or just yard work, sprains, strains, and tears can have an impact for weeks, months, or even years. No one knows this better than Jennifer Clark, who was sidelined by knee pain after years of running.
My knee just got banged up from many years of running, long jump, triple jump, stuff like that. It affected my daily life because I have 3 little kids, so it was tough.
When it comes to joint pain, most people consider 3 options: live with it, mask it with medications, or undergo surgery. But some doctors, like sports medicine specialist Brian Scheipel, say these options aren't enough.
Pain medication becomes a Band-Aid or a mask for their pain. Plus, there are side effects to these medications. In the United States alone, we kill over 20,000 patients a year due to complications from the anti-inflammatories. Surgery has its place, but surgery is a final event. And if the surgery goes well, which we always hope it does, the patients are usually better off, but that's not a guarantee.
Today, top doctors are pioneering cutting-edge minimally invasive treatments that truly address the root of joint pain. These treatments are prolotherapy, in which a dextrose-based solution is injected directly into the affected joint, ligament, muscle, or tendon. Platelet-rich plasma therapy, in which the patient's blood is drawn, spun in a centrifuge in order to separate the platelets and plasma from the blood and injected into the affected joint or affected structure. And autologous stem cell injections, in which the patient's own stem cells are extracted from their bone marrow and injected into the affected joint, tendon, ligament, or bone. In all 3 treatments, these injections stimulate the body's own natural healing power within the affected structure, where the body gave up on trying to heal itself a long while ago.
The least invasive, the least costly, and really the simplest treatment is prolotherapy. Dextrose, when injected into a joint or a tendon or a ligament, causes inflammation. So by creating some new inflammation, we're starting the healing process over again. The prolotherapy drawback is that it may not be strong enough for more severe conditions. Platelet-rich plasma injections, it's a stronger treatment, but it has a stronger potential to heal chronic problems, cartilage problems, bigger tendon tears, more severe arthritis. And then the autologous stem cell injections is the strongest treatment I have in my bag of tricks. We actually take their bone marrow, separate the stem cells from the rest of the blood, and combine those stem cells with the PRP and inject that into the target area. And the stem cells have a very exciting potential to heal, to correct cartilage problems and improve arthritis and heal tendon tears that would only be amenable to surgery.
After discussing it with Dr. Scheipel, Jennifer has decided to undergo a combination of platelet-rich plasma therapy, stem cell injections, and prolotherapy. Today, she's back to her active lifestyle.
Today I feel great. I wouldn't say 100%, but close to it. The only thing I really can't do is run, but I can power walk and take spinning classes and just go on with my everyday daily life without any constant pain in my knees. So hopefully maybe over the next year I can start running again. We'll see.
The future of these treatments, even prolotherapy, the literature, the research is almost there to the point where it, in my opinion and other researchers' opinion, this is going to become the standard of care for a viable treatment option for things like arthritis of the knee and tennis elbow and plantar fascia problems and things like that. It's extremely exciting and hopeful. I want to really give patients the hope of the future is we're almost there.
The Center for Sports Medicine is breaking new ground in the treatment of joint pain. Led by Dr. Brian Scheipel, this team is innovating advanced, effective pain relief techniques, including prolotherapy, platelet-rich plasma therapy, and autologous stem cell injections. Dr. Scheipel is one of only about 100 doctors who offer these therapies, and people from around the world travel to his Philadelphia area office to see him. He also teaches other doctors how to perform these minimally invasive procedures. In his new book, Regenerative Healing for Life, Dr. Scheipel explains today's solutions for people living with chronic pain and injuries and helps them understand which treatment option is right for them.
When we get into this discussion about these other treatment options, it's an eye-opening experience for the patient. They're not aware of it, even their doctors aren't aware of it. So this book project became a new source of information for not just the patient, but the doctors to understand these treatment options that are out there.
The Center for Sports Medicine is transforming lives, restoring patients' function, and helping them reclaim their health, fitness, and relationships.
I injured myself playing volleyball at a graduation party at my friend's house, and I realized I couldn't throw a football anymore, and that's been my whole life. My treatment options were either surgery, which would put me out for 6 months or more, and possibly miss my senior year of football, or come to Dr. Scheipel. I got the PRP first thing, then 5 weeks later, 5 weeks later, I started physical therapy for a couple weeks, and then I got a shot right before the season started of Prolo therapy in my shoulder, and it tightened everything up, and that senior year started. And he gave me the ability to play throughout the whole year.
I'm 47 years old. I've been weightlifting for, 20 of those 47 years. I started playing a lot of baseball and incorporating baseball into my daily life and weaning myself, if you will, off of the weightlifting. And the repetitive throwing motion, it was what probably led to the injury to the shoulder. I knew something was wrong. I had surgery, and I believe it is working right now. We're entering the 7th month of surgery. I'm still healing. I want to speed that process, but in the same manner, I want to keep the shoulder strong, and the PRP is going to help. Dr. Scheipel's evolved to more, high-tech procedures, and I've stuck with him because his procedures work. They've helped me. They keep me active. I'm an active person. He keeps me active.
If you live with chronic joint pain, don't go under the knife without finding out if you're a candidate for minimally invasive regenerative injection treatment. Visit drscheipel.com for more information.